Hi, it is the last hour of ADIC, the 22nd version of ADIC 2018, and I just finished my ergonomics lecture for the day, and I wanted to introduce Mr. Mohamed Khalifa.
Hi, good evening to all of you. So my name is Mohamed Khalifa. I'm a biomedical engineer from Egypt, and it's a pleasure to stand next to Dr. Yasmin. And we are here today to give you like a quick tips and tricks about ergonomics and magnification for dentistry.
I love the fact that you're saying we need to give tips and tricks about ergonomics, and you know what? What's happening is the ergonomic awareness in the market really needs a lot of support. And it starts with your awareness of how to sit, posture, and everything, and it ends with you using the right tools. So, do you want to talk to us about magnification a little bit?
Yeah, of course. So if you are talking about magnification, there are two main benefits from my point of view. The first is the vision control, the vision improvement over the oral cavity, which of course give you as a dentist a higher and a better way to treat your patient and a higher level of treatment quality and faster level of treatment quality as well. But the second thing that from my point of view it's much more important, which is the posture enhancement. Can you share with us like some statistics about the MSDs among the dentists?
MSDs, just to start introducing MSDs, MSDs are musculoskeletal disorders or any pain or injury due to your occupation as a dentist. And in a room, every three people or three dentists you talk to, one of them has MSDs. In another survey, it's saying that from 64 up to 96% of dentists have MSDs. So the prevalence of musculoskeletal disorders or any pain and injury because of dentistry is so high that in a room full of dentists, 1/3 only is free of pain. And isn't that a scary statistic?
Of course it is, but how the loops or the using the magnification will participate to prevent the probability of having an MSD. Let me give you like a quick review about this. So when you are working your loops, especially if it's custom made loops, there is a very important parameter called the working distance, which is the distance between your eyes and the oral cavity of the patient when your posture is in an ergonomic posture. So if you're trying to get back to your habit and bending like this to see some more vision of the patient, the magnification vision becomes blurred. So here, the loops or the magnification forces you to get back to the perfect ergonomic posture for you in order to prevent your MSDs.
I think you got a wonderful point there that it really helps you safeguard your posture. And I would add to it that sometimes loops are a double edged sword. So if you're not aligning them properly and you're tilting too much, they're creating a lot of heaviness and they are taking you off your angle as well. So the great thing about them is they help you if you have the right awareness and the right posture for you to put it up straight. I have a question for you. How can the regular dentist choose his ergonomic? What are the factors he should be choosing his ergonomics from?
So normally, when we are speaking about the best magnification power that leads to a better ergonomical status, there are some factors. The first factor is the age, and the second is the most common procedures that the dental professional is doing, and of course his experience with the magnification. So if it's the first time to start using magnification, our recommendation is to start with like 2.5 or 3.0 magnification to start getting used to it.
Yes.
And then if you want to upgrade, you can. And it's not a necessity. It's not a necessity to upgrade your magnification power because, for instance, I know some dental professionals who are my friends, and they are using magnification for around 6 or 7 or even 10 years, and they don't intend to increase their magnification power from now.
It's not a must.
No, it's not a must.
What I usually say is learn to walk before you learn to run, Because if you're trying to run with a 6 Zoom and it's just your first time and you have a very busy schedule and you have your patients and you're very crowded and busy, one patient after the other, and you're trying to learn to magnify, it does not work this way.
Exactly.
So I usually advise people to take it easy, take it step by step, and have a decent learning curve. It can't be shooting up in the wall. It has to be gradual, and you're learning your muscle coordination, your eye muscle coordination, your posture. Everything is a new learning curve. And if you're learning to walk, eventually you jog. Sounds good? Do you want anything else to add to our general dentists if they're trying to have any knowledge from you at all?
No, I think this quote is a perfect end for this video. So before starting to run, it's better to start to walk. That's the best thing that we can say. Thank you for this.
Thank you very much, and thank you very much for watching. My name is Dr. Yasmin Kottait, and I'm a specialist pediatric dentist. And if you have any questions for us, we'd love to share our knowledge and our education with you. Feel free to get in touch. Thanks.
Thank you. So what we are providing here to the dental professionals in UAE is an Italian genius of custom-made loops. Its name is Univet, and it's customized in different aspects. First of all, the magnification power. We have a wide range of magnification starting from 2.0 and it's going up to 6.0x. And the frame styles, we have an Italian designer in the company there in Italy, back there in Italy, and their main job to design new frames and to launch it in each IDS conference in Germany.